Alrighty, so this is an extended abdominoplasty on a medium-sized panniculus. But what you can see consistently here is the complete lack of bleeding, right? And meticulous to the point of being ridiculous. This is a very unique technique, and we do it consistently and predictably, right? We tell your patients, okay, just look at the patient from tomorrow. We predict the future, right? Tomorrow's case, why? Because in the past, that's what we do, right? So we can predict it. Thank you. Hi, Dr. Patino here at the Cosmetic Surgical Center of Cerrito. So what are we doing now is a tummy tuck, and look at the complete absence of bleeding here at the Cosmetic Surgical Center of Cerrito. What I'm going through here is we call this the specimen. This is something that the patient doesn't want. This is what hangs below the belly button right there. And this instrument is an electrocautery. This is nothing special about this instrument. This is something that's been invented many, many years ago. And it's something that every surgeon has. So it's not the instrument what makes it bloodless. It is precisely a combination of factors. You know, the fact that we tell the patient not to take any aspirin or ibuprofen or herbs or vitamins for 2 weeks before and 2 weeks after the procedure. The surgeon doesn't give any vitamins, no aspirin, no ibuprofen, no herbs of any kind, no enoxaparin, no blood thinners whatsoever, right? That's super important, right? Because otherwise there's going to be bleeding. Some surgeons do that. Some surgeons do give aspirin. They do give ibuprofen. They do give a multitude of vitamins. They do give enoxaparin and heparin and things like that. So obviously then there is not going to be bloodless surgery like this if you do all those things, right? And they do it for a reason, you know. The main thing is that one of the biggest complications here with this procedure would be a blood clot, right? So you want to prevent that, because a blood clot can go into your lungs and can kill you. And thanks to God, we never had anybody die. We want to keep it that way. But the best way to protect against a blood clot is not enoxaparin. So it is early ambulation, meaning that they walk. And our patients walk out of the operating room. They go home. You can see them on TikTok, and people are like, "Wow, what are you doing this? Don't they need to rest? Don't they? Because don't they need bed rest?" That was what was prescribed many years ago. Today, no, we know that bed rest is not good for the patient after surgery, because they can certainly get a blood clot. So we want them walking. Our patients walk 1 mile the first day, 2 miles the second day, 3 miles the third day, preventing a blood clot. Thank you. So this is definitely a different technique with much less bleeding and bruising and a faster recovery. If you would like to have a procedure like this, please give us a call, 510-525-7999. Thank you.
Specimen Dr. Patino removed from the patient's left side, or you can see no bleeding, and most of her search marks are gone.
Thank you.
Thank you. This is the right side specimen with no bleeding as well. Thank you.
Thank you.
Alrighty, so what are we doing now?
Creating a new home for the belly button.
Creating a new home for the belly button, because the belly button is inside, right? The belly button is where it belongs, right? It's our own belly button, right? But notice this technique is called de-epithelialization, right? We did that on Friday, right? When we did a breast lift, and that's a technique that is routinely used for breast lift, but it's not used for abdominoplasty. At least I don't think it's been described. And so I came up with this idea of de-epithelializing this area for the belly button for a couple of reasons. One is so there is no bleeding, right? Because the dermis is a vascular member. And the other one is so that I don't burn the surrounding skin, because that rim of white dermis that you see is going to protect me because this instrument can burn. Thank you. So this is your belly button right here, and this here is a hernia. It doesn't belong here. This is a spot that belongs inside. You see how there is a hole there? That's tiny thin, but we found it. And we're gonna now repair the hole where it came out of. So you can see how I go in, see, it goes in. Doesn't go in here, but it goes in here because there is a hole there. It's a congenital, meaning that she was born with it. Umbilical hernia, thank you. So for those doctors watching out there, this is all proline, and we're basically closing the fascia defect right at the 12 o'clock position on the umbilical stalk, okay? So if you let go here, this is your belly button right there. So it looks like a little mushroom, and the hernia right on top here. And we're gonna test it just to make sure that nothing goes through, right? And see, it's a little bit still, see? So we're gonna make another, there's a tiny hole there, so we're gonna close it. Yeah, good thing we tested it, right? So we're gonna use 2 of these figure of 8 proline sutures to go after this tiny little hole there, right? So we gotta close it completely, otherwise it will basically come out, right? Again, so the fat that's inside, right, it wants to come out through this hole, right? And when you do this, there's an increased risk of the belly button dying, you know, because especially in this area, that's where the blood supply is. But I think it's important to do it, you know, so we're gonna go ahead and close this hole so that there is no hole for the hernia to come out, right? What a hernia is an abnormal opening, right? In this case, it's right around the belly button area, and we are closing it, right, completely now so that it doesn't come out again, right? And so this is all proline, and we do 4 knots on the all proline, 6 knots. So this is 5, and now 6, and then, all right, so now what we're doing is we are going to remove the burn edge of the belly button, right? That was already burned with the cautery, right? And so now, you know, we don't want to put anything burn. And, you know, remember how we took care of the hernia, right? So the hernia, we're also going to remove, right? And we do this before your eyes in a bloodless manner. And this is just incredible here at the Cosmetic Surgical Center of Cerrito. Look how beautiful that looks. And look how nice, tight and flat she is with the rectus plication above and below the belly button. We use figure of 8 proline for the first layer, and we did a double layer with a continuous suture of proline, and we were able to hide the repair under that double rectus plication. So we put the rectus abdominal muscles that got separated during pregnancy and restore her anatomy to pre-pregnancy state. Thank you. Alrighty, so we are done. An extended tummy tuck and a hernia repair on this patient. She looks absolutely beautiful. 0 liposuction. Thank you.